Alright, you're welcome to another amazing moment with Mona Bria Consult. A massive mother reached out to me and she was like, "Hey Mona, can I use teething powder for my child?" And I was like, wow. So today we're going to talk about teething itself. What do you mean by teething? Teething is a process or is a normal developmental stage by which the child's first tooth comes out of the gum. That's the primary tooth or milk tooth, anyone will call it. So, and usually happens between the age of 4 to 6 months. Some child it might be earlier and some it might be later. So when this happens, so majorly from 4 to 13 months, the central bilateral incisors of both the upper and lower comes out, and from 13 to 33 months, the molars will come, and then from 16 to 23 months, majorly the canines will come out. So now, what are the things that happens during this stage that you see in the child that you know that this child is beginning to erupt tooth? So one of it is that the child will drool often. One of it is there will be swollen or tender gum, and one of it is that the child will be chewing on his or her fingers or toys. Another thing is that there will be irritable, like the child will feel irritable, and then there will be difficulty in sleeping. Another thing is that there will be raise in temperature, that there will be temperature, like the child will be having some temperature, and then again is that the child will have trouble sleeping, and then there will be decreased appetite. So once you notice this, what are the things that you are supposed to do for that child? One of it is that you gently massage the baby's gum, gently massage with a clean finger. Another thing is that you offer a clean teething ring for that child, and then sometimes you can give the child to chew on a wet clothes, and sometimes you ensure that you wipe the drool often to prevent rashes, and again you ensure that you provide extra care by giving that child more comfort, cuddling the child and all of that, so that at least their emotional state might be okay. Now, what are the things that you are supposed to avoid during this stage? One of it is that avoid teething powder. When I say avoid teething powder, most especially those ones that are not even regulated, avoid teething powder generally, because most of it contains something we call lidocaine or benzocaine. And now when this teething powder contains lidocaine or benzocaine, it might cause difficulty in breathing for that child. Another thing you should avoid is that you should avoid something we call amber teething necklace. This one can cause choking in the child, like the child might choke. You know, they are infants, their things are regulated for them. So another thing is that avoid giving that child alcohol. Maybe you rub alcohol on it, maybe for them to feel lesser pain. Do not do it. Do not rub honey as well on it. Do not rub honey on it, because honey, it might lead to something we call infant botulism, because at that very moment the child digestive systems is not strong enough to absorb all these things, so it might cause infant botulism. Another thing is that avoid all the ABA concussion and all of that. Maybe you now want to rub it on the gums. Avoid them. So these are the things you are supposed to avoid. And then, when are you supposed to see a pediatrician? Immediately you see that the child has there is raise in temperature of the child, because not every raise in temperature of that child is because of the teeth that is just coming out. So when there is raise in temperature and there is fever, you go and see a pediatrician. And when that child refuses to feed very well, you go and see a pediatrician. So when there is when the gum is swollen, ensure you go to the hospital to see the pediatrician. And then when that child is not sleeping well as well, go to the hospital to see a pediatrician, or go to the dental clinic to see a dentist pediatrician, so that they can rule out the possible things, and then they will give that child the medications that they were supposed to give. So what we are saying is avoid teething powder, avoid rubbing honey on the child's gum, avoid rubbing alcohol on the ABA concussion on the child's gum, and do the right thing. Thank you.